Welcome to the Veterans Impact Show, where our commitment is to help, hope, and healing of our veteran family and our nation. I'm Jim Blythe, a U.S. Navy veteran and a certified senior advisor. Join us as we continue the mission of leadership and commitment to our communities and our great country. Why, you never know where we're going to go or who you're going to meet. We invite you to join in, plug in, and share in what we do. This is your Veterans Impact Show. Hey, great day and welcome aboard. This is Jim Blythe. I got to tell you, I've got a really, really interesting program. You're going to want to tune in, plug in, and be a part of this. We're going to be talking about health. Now, that's a big topic for us anytime when we talk about health, happiness, wellness. We're going to talk about some things that are a little bit different. I'd like you guys to welcome Dr. Sherine Reno, Medical Director of Performance Sports Medicine. Dr. Reno, welcome aboard. How are you?
I'm doing great. Thank you very much.
Dr. Reno, tell me a little bit about your background, because you told me, I mean, it's pretty interesting. You were a dance major in school, and then you became a doctor. Wow, that's something. Tell me a little bit about that.
Basically, I originally majored in dance and theater back at Southern Illinois University back in the 70s. Had a career where I was in multiple regional ballet and theatrical companies. I actually even did one Broadway tour. Loved it, actually do, but ended up getting married, and then being able to just travel at will was a little bit more difficult. And so after having children, I decided that I wanted to go back to school and learn some biology so I could teach biology in school, and actually found out that I was pretty good at it. Was talked into taking the MCAT, got a pretty good score in it, and got admitted to Baylor College of Medicine in Houston, Texas. And it was a wonderful education, and I used all my dance skills every day, and I do even now today, because it taught me how the body is connected, how it works, and things that you can do to help it perform optimally and recover when you need to.
Well, I think a lot of people don't really realize how much athleticism is required for ballet, for professional dance. I mean, they don't understand. I told you the story about my seeing Rudolf Nureyev for the first time and was so amazed. And I got to tell you, there are a lot of professional football athletes that would give anything to be able to jump as far as that guy could. He was something else. And the skill, the precision that goes along with it. So you're moving every part of your body. I think that's truly amazing. And that got you into then the sports performance medicine. And you own, I believe, you're medical director of performance sports medicine. And that's here in Dallas?
Yes, it is.
Okay.
And we treat athletes of all levels. We have even treated Olympic athletes and some people with the gold rings in the football regime. All the way to, people, their basic sport is life, so we treat all levels, and we use an integrative medicine type approach to optimize people's outcome.
Now, I was introduced to Dr. Ashmore and Symbiose Integrative Health, and I had her on, and she is a great lady, good friend. Symbiose is a great provider using neuroacupuncture. Is that probably the best thing to call it?
Right.
And then you do that, plus you use a laser as well, which I was introduced to a guy with a class 4 medical laser. When you're talking about integrative health, a lot of people are really confused, and they go, what does that mean? I know what maybe alternative health means, and so they're thinking about non-traditional medicine versus traditional medicine. So explain what integrative health means for lay people like myself who don't really know.
Well, I'm sure people can have different interpretations. For me, it is using everything that you can to help treat a particular injury that goes from nutrition to correcting biomechanics to using all standard medical treatments. We use everything that's standard first, but when that's not enough, that's when I use these other interventions. And I found them to be actually really wonderful and complementary.
And it works to a whole body, a whole health type situation. So if most doctors or most medicine are focused on one organ, one part of the body, what you're talking about with integrative, as I've learned, is the whole body. So you're
Yes.
encompassing everything.
Yes, it is. I mean, to be honest, if you don't have good blood flow, you're not going to be able to heal various injuries, especially tendon and cartilage injuries that have some of the lower blood flow amounts that are supplied to them. So we look at everything that we can. Actually, right now, I'm diving into nutritional genetics right now, and I'm finding
Really?
out that there are certain people that will have a tendency, they may need more calcium or they may need more vitamin. Like I myself do not convert beta carotene into vitamin A. And so I need the retinol. But there's various variations in our genes that make a difference in what kinds of foods and vitamins that we need. So I'm using that on some of my, on myself, my staff, and a couple of our elite athletes, and getting some better results. I've had people that athletes, actually, a lot of the dancers and skaters and gymnasts, they do enormous time commitments to training. They have to have a lean physique, and so they often are not eating well. And I found a number of them that have osteoporosis, actually. Their bones are so thin because they haven't been taking in enough nutrition. Well, everybody says that that's, they're stuck with it. It's not going to get better. We try to keep it from getting worse. But with vitamins and with the proper vitamins and adding additional nutrients and protein and things to their diet and using actually the laser, we've brought them back up to normal. So I'm looking forward to the future of other people catching up to me.
I think that's brilliant. When you say the laser, let's qualify that, because most people, when you say laser, they think of a cutting tool that cuts steel or whatever. It's not that. It provides light energy into the body. It does not cut. Correct?
Correct. I mean, actually, for the lasers that we use, it feels kind of warm and relaxing. We use lasers that have about 800 to 1200 nanometer wavelengths, and it will go through the skin and get to the muscles, the tendons, and the bones. And it, like I say, it's relaxing. It relaxes the muscles and things like that. So most people feel really good when they leave, but because it has functions that it improves the blood flow. It also stimulates the mitochondria in the cells to make ATP. And when you add the nutrients that we have from our vitamins and our nutrition, the increased blood flow, so it gets to the cell, and then you have the energy from the mitochondria in the cell, then the cell does what it's supposed to do and it heals. It is phenomenal. We've taken, when I first got our laser, we have Aspen lasers. I looked at every injury that we had, every age, all the knee injuries, all the ankle injuries, all the shoulder injuries. And I compared our time for healing to what was standard in the industry. So if something took 4 to 6 weeks to heal, using my vitamins before, I was always kind of at the 4-week level. But then when I added the laser, it went even below that. So sometimes 2 to 3 weeks, people would heal. And every single injury did the same thing. And so there were a couple outliers that they didn't respond. I've had some people with gout that don't respond to the laser. There's a few things that won't work, but a lot of things for athletic and musculoskeletal injuries and some nerve injuries, actually, it does help a lot. Actually, the vector is really wonderful for any kind of injury to the nervous system. Symbios is a place where we have been offering that to the veterans, and I've had some really good results with that as well.
I'm very familiar with a class 4 medical laser because I've got one. I helped a man by the name of Gary Bellinger with a company called Phoenix Theralaze, and they did a clinical trial in Chicago at the burn unit with a Dr. Polakaitis. And what was so amazing is they were treating burn victims that the skin grafts wouldn't work, and they would treat them, and then the skin grafts would work. They also, they had a patient with a diabetic ulcer on his big toe. And as a medical doctor, you get a diabetic ulcer, it's going to be amputated most of the time. You can't cure them. They treated that. with the laser, and it worked, and they didn't have to amputate. I have heard the same thing about the vector because it has increased blood flow, and that enables the body to heal.
Right.
And so people don't know. And, you know, where do you go to find out? Well, for one of the things, Symbios, as well as performance sports medicine, you're using many of the same procedures, modalities. What
Right.
I liked about Symbios, where the laser is very directed, Symbios, you're looking at more of a total body. Am
Right.
I right? I mean, I'm a layman. I don't know what I'm talking about. I just know what
Yep.
I've experienced.
Well, it does do a total body things, but it actually can hone in on whatever part of your body is injured as well. I actually had an injury myself, and this is how I kind of find out about the vector in the beginning. I had something called idiopathic brachial neuritis, which is an autoimmune attack on the nerve coverings of your nervous system in your shoulder. And basically, I'd tried everything standard medicine had given me. They gave me all the medicines, the gabapentins, the Lyrica, all the, even up to the opiates, and nothing helped. And I was thinking I was going to have to retire from medicine at that time. And then I met a physician, Dr. John Townsend, who introduced me to Dee Dee and said, she has a new treatment. Maybe it'll help, maybe it won't. But since nothing else is helping, you know, you might as well give it a try. Well, I did. I went in and they hooked me up, and I'm sitting there going a little skeptical, but at this point in time, I'd try anything. And didn't feel much that day other than a little buzzy, but I'd been having like level 7 to 9 pain every single day, all night. Well, I woke up the next morning and it was down half. So I was just shocked. I go, well, I hope this lasts, but I had 4 or 5 more sessions and it went down to level 1 or 2 and I could work, didn't have to retire. And over time, it completely went away. So it was a really wonderful thing. That's when, you know, I have gotten multiple of my patients over to her for treatment. Right now, she's just primarily working with veterans, but it was one of the things that I had to study, and I figured out why I thought it worked. And I don't have a study that proves this, but how I think for myself it worked is our nerves are like electrical wires, and they have an insulating covering on the outside of them. Well, my autoimmune attack kind of wore away that covering, so it was constantly misfiring. Well, we have 2 basic types of nerve fibers in our bodies. You have some that conduct pain and temperature, and you have some that conduct light, touch, and vibration. Well, when the pain and temperature ones get disturbed, they normally when you like feel something painful, like you put your hand on a hot stove, your body gives you a signal and you pull it away, and then that pain goes away. But in chronic pain, the nerve keeps sending pain signals, even when nothing else is continuing to injure it. I think the vector resets those nerve fibers so they stop sending the pain signals.
One of the things that Dr. Ashmore, Dee Dee, tried to explain to me, and again, I'm a layman. I'm not a doctor, but I know what I feel. I know what helped me. But one of the things she talked about is it makes changes in your hypothalamus, I believe. Mm-hmm. Okay, one of the things I read, and I've been reading this book, which has been fascinating to me. Now, to tell you the honest to goodness truth, I don't understand much of what's in here because I'm a finance guy and a broadcasting. One of the things the book said was that by utilizing acupuncture, you have normally in your body, in the hypothalamus, in those things that are in your brain, it creates, and I'm going to use maybe the wrong term, but like a pharmaceutical cocktail of all of the things that are in your body, the endocrine system, and all of these things that maybe for whatever reason are not there. And this helps to stimulate that. So all of a sudden, all of the things that help you to heal are remanufactured. Is that
right?
Okay. Wow. Well, then I did understand it completely. And as a result, all of a sudden you're seeing total body healing, which
Yes.
you don't see with the laser. You see an isolated, because I have it. Now, correct me if I'm wrong. You
Mhm.
can use the laser on a larger areas by multiple treatments, and that's how you can really take care of some things. But the vector, if you were to use the two together, it would be amazing
Be
what
phenomenal.
it
Yeah.
is.
I'll
Yeah.
be honest, in my clinic, we don't use a lot of clinics will have somebody come in and they'll have a 15-minute session with a laser and it'll point just at the part that's injured. We often do the whole kinetic chain. So if it's a shoulder, you'll do, the lower neck, the upper shoulder,
Mm-hmm.
the biceps, triceps, elbow, wrist flexors and extensors. You work the whole kinetic chain because if something's hurt, then that whole area is hurt. And to be honest, then, later, you're exactly right. We need to heal the whole body. And sometimes people will come back and say, well, now this thing has been, injured in the past. I'd like it to feel as good as the other side. So, but like I say, using things together, using the nutrition, using the laser, using the vector, using things together,
And
is where
physical
we get the
therapy.
most optimal results.
Yeah, and physical therapy, because if you ain't moving, it ain't grooving.
Exactly. You
That
got to
was
correct
pretty
those
good.
biomechanics. You've got to make the joint. And that's where the dance comes in every day
Yeah.
is like, I know every joint and how it's supposed to be able to move for optimal. And I know a few people are too gumby. And so it's like, okay, we got to slow that excess extension a little bit. But you have to, the body is meant to work in certain parameters and we have to get it there.
Well, and I think we as a civilization now have automobiles. We have all of the pieces of equipment. I've seen wheelchairs using the Segway that are amazing. We
Yeah.
don't walk
Yeah.
like we used to. I mean, in ancient times, people walked. Everything was muscles. Well, I tell you what, we're going to take a break for a second and come back. I want to continue this conversation about total body healing. Now, you're talking about nutrition. We're talking about class 4 medical lasers. We're talking about the vector, which is acupuncture without needles. That's what's so amazing to me. And we can talk, because I know Dan Rhodes, and I've had him explain how he figured it out. So when we come back, we're going to be talking more with Dr. Sherine Reno. Did I get that right? That's such
Yes,
a pretty
you did.
name. Yeah. And so thank you for being on board, and we'll be right back with these words from all of our partners. This is Veterans Impact Show. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Hearts Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. I've got Dr. Sherine Reno, MD. She's got performance sports medicine, and she was a ballet dancer. She's now a medical doctor, and they do sports medicine here in Dallas, and she uses a number of things to be able to heal people. It's a fascinating conversation because I know a lot of veterans that are in pain, but I also know a lot of other people. Now, yeah, who are, I mean, man, I'm 78, and let me tell you something. I got bad back, and there are times when I really hurt. And there's also my knees hurt. The older you get, I'm beginning to realize the older you get, the less blood flow you got. Is that true?
That's true.
Now, also, one of the things, I'm a certified senior advisor. I work with the elderly in what I do. And one of the things I read is they're now calling some of the forms of dementia as a result of lack of blood flow to the brain. I believe one of the terms they're using is diabetic dementia. And what I have heard and what I've seen is that some dementia, some of this can be turned around. Can't be cured because you have to have a follow-up maintenance. But by getting the blood flow going to the brain, you can reverse this. Is that not true?
I feel, especially in early dementia, if you catch people early, yes. I'm not a neurologist and I don't normally treat a lot of those patients, but Generally, when we get people, even in my clinic, we do some older patients, and when we get them moving, their family members say they start thinking better. And some of them may just be improvement in mood, but I do believe it's a blood flow issue to an extent.
Well, see, I also believe healthy mind, healthy body. If your body is in pain, you can't focus. If you're in addiction to prescription medicines, which many times athletes, veterans, people who have been in accidents are taking all kinds of opiates, with Vicodin being what? Probably the number one prescribed opiate.
Right.
And
all the hydrocodones.
Yeah, and that's very addictive. So and they do affect your brain. I know. I took them when I had some real bad back problems. And it will also mess up your kidney. Been there, done that. What happened was I was down to 14% in my right kidney, 100% in my left kidney. They wanted to take the right one out, and I said no. I ran into Dr. Ashmore in Symbiose, and for some other reasons, I started using the Vector. And my last lab results, my numbers for my kidney function went to normal.
Oh,
I hadn't been
fabulous.
normal in 15 years. Went to normal.
Yep.
And they told me that once your kidney function goes down, it'll never go back up. That's not true. I found it for me. Now, everybody's body is different, correct?
Correct. Everybody's body is different too, but I think that we in the medical community don't look at basic nutrition and alternative interventions the way that we should, because we look at our studies are set up so we look at one parameter at a time, and you have to eliminate everything else. Well, sometimes it's not the one thing you did, but it's the three things you did that healed you.
Yeah. You know, high consumption of alcohol. Trust me, I was in the Navy. I've been there, done that. And I have a relative who's had alcohol problems. I've got several relatives. And that really affects. And it takes 2 years to seriously get all of that toxin out of your brain and out of your system. The other thing that we've seen is Diane has a real close friend, and her husband was in a car accident. For 6 months, he was fine. Everybody thought, well, you're okay. I mean, they had to have the machine, the jaws of life, to get him out of the car. It was so bad. Everything's fine. You're not all busted up. You're going to be great. 6 months later, he was incontinent. He couldn't feed himself. He couldn't put his clothes on. And unfortunately, and I'm probably going to be criticized for saying this, she took him to the doctors, and they said, took him to an ER, and we're talking to the doctors. I said, what do you want us to do? There's nothing we can do. Put him in a nursing home. So Diane said, hey, go to Phoenix Sterilase and use the Class 4 medical laser. And they used that medical laser on his head, his neck, his shoulders, the spine. All of this is a transmittal system, correct?
Right. Yes.
I saw him about 6 weeks later. You wouldn't have known anything was wrong. He was driving himself to the clinic. Now, what I've also seen is you have to keep up a maintenance program.
Right.
Okay, it will not cure. It will not cure.
Certain things I think it will cure, but for most of us, if you've had a serious injury, the maintenance is an important part of continued recovery.
Yes, without a doubt. And then that goes to nutrition as well. So if you were doing this and you were continue to smoke cigarettes, drink Coca-Cola, and have a gin and tonic, you're not helping yourself. And
No, you're not.
No, not at all. So it's
I guess, you know what? Something that I did find that was interesting to me is it also, the Vector also seemed to help the patients that I saw that had PTSD.
I think
that was, blood flow to the brain.
Well, we're going to have to take a break in just a second or a minute. And when we come back, I want to talk about that because when I was going to Symbios and getting treatments, I was talking with these other guys. It was like a room full of guys in a group setting. Okay. It was like a big therapy deal. Yeah. And I got to tell you, almost every one of them had some form of PTS. And yet their minds were clear. They were doing great. And they said, wow, we don't have the thoughts of suicide anymore. One of the biggest things that we in this country have been talking about for the last 10 years is suicide prevention. The VA says we got 21, 22 guys a day committing suicide. This is something that when we come back, we're going to talk about what the vector will do in terms of changing attitude to gratitude. So we're going to be right back after these words. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. Hey, this is a great conversation, but I need to throw in right quick a thanks to DBTV Network that puts us on Amazon Fire, Roku, smart TVs, and the AUN TV network out in California. I understand you guys just had a 7.3 on the Richter scale, about 60 miles off the coast. So tsunami warnings, by the time this gets out there, you'll be past it, but God bless you. We're praying for you. So I want to thank those networks that carry us around the world. I want to thank Fairway Independent Mortgage, my company. I'm a reverse mortgage specialist. My NMLS number is 311548. Our corporate is 2289, and we're at 350 Cedar Sage in Garland, Texas, Suite 250. We are an equal opportunity lender. I specialize in helping the elderly. That's why I'm a certified senior advisor. One of the things that I really enjoy too now, thanks to broadcasting, thanks to 10 years worth of talking to veterans, is I've learned about things like the vector and the class 4 laser and about nutrition and about how do you rehab. And there are people like Dr. Reno who are doing it all, and people like Dr. What? Oh, Ashmore. I got two people talking to me. And I got to tell you, it's great. There's so much out there that can help you to restore your quality of life, that can help you to restore your ability. There was one guy, Dr. Reno, that I met, you may have met him, that worked for Dr. Ashmore, who was a Army Ranger, parachutist, jumped into a hole at night, messed up his legs. What he told me is when he went to Symbios for pain management, he was using a walker. When I met him, he was up and around, and we were talking about it, and he could jog. He said, I can't run, but I can jog. But he said, also, I feel great. My mind is opened up. I can help people. So when you were talking about how this seems to help with mental health, it really does. Tell me a little bit about what your experience there from some of your patients.
Well, I'll be honest, I was primarily working with pain, but you treat the whole patient. I would refer them to psychology as well. But even sometimes before we could get them to the psychologist, just taking them in and having several sessions of the vector, they began to feel much less depressed. They were when I would talk to them, they were more open, enjoying their lives more. It was kind of phenomenal. And it really would take, like 2 or 3 sessions, and it was kind of amazing. But with my pain condition before, it only took a couple of sessions before I started to notice a difference. So I think it's something that works relatively quickly. Does it work on everybody? No, but it works on the majority of us. And even if your pain is less, your psychology, your depression, anxiety, and stress will be less. And I think the improved blood flow that it causes causes people to remove the toxins out of their brain tissues and stuff. Sometimes it's just that.
I think so. And one of the things that Dr. Ashmore told me is not only is it increased blood flow, but it's increased oxygenation in the blood. Now, I don't understand how that happens. I'm not a doctor, but with increased oxygenation, cells heal. That's the ATP protein. That is the mitochondria working. The other side of that, and maybe you can explain this, or maybe you understand it better than I do, cancer cannot survive in an oxygenated body. I've heard that repeatedly. And
That's
when
true.
you increase an oxygenated blood flow, if you got early stages of cancer, it's going to reverse it.
Right. Again, not an oncologist, so I only have some anecdotal evidence of patients that I've had. But that, that is the studies that the experimental studies that basically find that cancer doesn't survive well in oxygenated. It likes the deoxygenated, more acidic type of environments. So oxygenation reverses that.
Now, one of the things is you talked about an acidic environment. One of the things I learned is what you eat is who you are. If you eat things like red beef, lamb, if you eat potato, you eat starches, that makes your body acidic. Candy, one of the biggest culprits for cancer is candy, right, Diane?
Yep.
Absolutely. And so you don't want to have candy. You don't want to have an acidic body, a lot of caffeine. You don't want to be drinking cola-type drinks, the highly acid. These things promote cancer. Cancer feeds on that. So you've got to change your diet. It's part of a whole system of treatment. Now, what do you do for someone like that? What do you do to help them, or can you?
You know what? Basically, what I'm doing now, I'm new on that new nutritional genetics journey, but basically, as much as you can, get back to whole foods, as close to organic as you can afford, and don't have a lot of processed foods. Those are the things that lots of lean meats and vegetables are the things that I tell people to have the most.
That's what Diane and I do, and I love fish. Now, I have gout. I think you were mentioning the fact that maybe the laser didn't work on somebody with gout. I had
one patient who did not.
Huh? Okay. Let me tell you what I learned about myself, because I have gout. It's hereditary. It's all about my diet. If I don't eat beef, starches, sugars, these various things, Dr. Reno, I don't have gout. One steak and I'm crippled. Diane has seen it happen. A wonderful big apple pie, I'm crippled. I mean, it can be as much, or a glass of wine, alcohol. Man, I can have maybe that much wine. And all of these things then contribute. So even if you're doing the work with the laser or the vector, you've got to include nutrition. And I also have noticed that Dr. Ashmore with Symbios had an unbelievable staff of psychologists. Mr. Ely headed that up. And as a result, they were doing follow-up. So again, that's part of this total thing for the PTS. It worked.
Yes. They had excellent counselors for that. And a lot of our veterans, unfortunately, just haven't had access to somebody where they could work through those issues and then have somebody help them be able to frame it in a more positive way. So, but these Symbios has wonderful counselors that have special expertise in that.
Yeah. Hey, Jordan, could you possibly put up side by side or above and below Dr. Reno's company and Symbios's website so that people can see those in the third frame? So my engineer, thank goodness I've got people smarter than I am to help me with this. But this is important because this could change your life. For seniors who I work with predominantly, they're not always veterans, or there are very few veterans now, but life has dealt them some bad things. Okay, this is your website, and that is amazing of what you're doing. And
Right.
this could help people. Now, how can people get a hold of you?
They can basically call in 214-342-0400. They can go to our website. We're happy. We have appointments every day. Susan's going to tell me something in a second, but just look online, give us a call. We're happy to talk with you at any time.
You bet. Now, are you in North Dallas, or where are you in Dallas?
Yeah, we're in far North Dallas. We're just kind of we're just off of Preston Road, just below George Bush.
Oh, I know exactly where that is. We used to live pretty close to there. Now, are you part of maybe an association or affiliation of other medical doctors that practice integrative health that have these modalities? Or are you the only one? Because Vector, I don't find anybody who knows it, understands it, especially as well as Dr. Ashmore does. I mean,
it is difficult to find doctors that are in the mainstream that use these things. I have a few people that I can refer to that are integrative health, functional medicine doctors for the internal medicine kind of things that are out of my scope. But it is harder to find them. But I have faith that more and more are going to be trained. And I have had some requests for some doctors to do a sports medicine rotation with me, but I just don't have all the academic things set up so that I can test them well. But so we're small. It's a single doctor clinic with my staff. So, but people are interested in it. So I'm hopeful that more people will be trained and be available.
well, one of the things that we're trying to do, and I think in conjunction with doctors like you, is spread the word about how these different systems can come together. The psychology, the vector, the laser, the rehab, the movement, dance. I got to tell you, matter of fact, let me tell you a quick story. I had my CSA meeting at a facility in Dallas that takes care of memory patients. And this lady got up and said, I'm Dr. Such and Such, and I'm the head of memory care. And 2.5 years ago, I had a terrible stroke and accident, and I couldn't talk and I couldn't walk. And I'm thinking, wait a minute, lady, you just walked in here, talked to me. You're now standing up addressing this group of people. What happened? She said, what I figured out as a medical doctor is you can rebuild pathways in the brain. And in doing that, she said, I learned to regain my speaking skills, my English, by learning Spanish and trying to conjugate verbs. Now, I don't know if anybody has ever taken Spanish the way I did as a kid, but that's a job. But working her brain, and then her English skills came back. The other thing she did was she did dancing. She started in a chair, dancing with music, and her husband helped her, and she got back into dance. Exactly what you're talking about. These kinds of things done like dance in conjunction with music, very, very, very healing.
Absolutely.
You
have to use your brain whenever you're learning dance and all the steps and where you go in space and how high you kick and how low you go. All those things take your entire mind and body to perform. So it's always a good therapeutic intervention for all of us.
Exactly. So as we're coming back around, what I found in sitting there with Symbios, what you have found, if you get the body healed, you stop the pain, you get the body healed, then the brain can be able to function the way it's supposed to function. And some of these effects, whether it's Alzheimer or dementia, PTSD, can change. Not everybody is the same. Not everybody's going to be able to redo this. But many cases that I've seen, and I sat there in Symbios and listened to these guys, it was amazing. I mean, I was shocked. And
it's putting the things together again. And for medicine, for a long time, we're taking them apart and separating them. And that's what's exciting to me, to see that the results that you can find when you do that.
What are some of the other things that maybe you have run into? You're talking about nutrition, vitamins. Are there certain supplements? I mean, one of the big things that's being pushed now is CBD oils. I tried, it didn't have any effect with me. It didn't help me at all.
I've tried a couple of those on some patients. They're minimally effective. It just depends. Again, it may be a genetic basis of who's going to respond and who's not. But basically, I do a good multivitamin, vitamin C, glucosamine with chondroitin sulfate, and omega type things. And we get a lot of people feeling a lot better. You can have nutrient deficiencies. And sometimes it's just like you didn't have the right kind of folate, or you didn't have the right amount of B vitamins. And normalizing that improves your function just tremendously. So actually, there's a couple of people that I know that didn't have enough selenium. And when they had selenium, then suddenly their thinking processes improved.
Really?
And I'm getting into the point where I'm going to start doing some labs and looking for those micronutrient deficiencies, now that I know with my genetic testing that people can have those. And actually, for me, when I went through menopause, I was one of the ones that was like, okay, a little DHEA and selenium, and suddenly I could think. And I was like thrilled with that. So, but that's when I started realizing certain people can have micronutrient deficiencies. My go-to thing is just, let's give them a good multivitamin. That'll probably take care of most anything that anybody has. So I would highly recommend that to everybody.
Well, I do that. Diane does that. And then I take other supplements for my joints because I messed up my right knee. But one of the things that I did not understand, because I supposedly was bone on bone, it's not so much about the cartilage as it is that fluid that's in the knee. What's it called? The synaptic fluid? Is that correct? Synovial. Thank you. Okay. So once I started using the Vector, just like the guy that I was talking about, the Command Master Sergeant, mobility came back because that fluid came back. Do you stop at some point? The injuries or age or something stops that production of that fluid?
You know, you just had some injury or some that those cells weren't working optimally. And your Vector probably improving the blood flow, the oxygenation, and the nutrients to that tissue, it could reconstitute itself.
Wow. So that's what helped me. I can do deep knee bends now. Not a whole lot of them, but I can do it. All right, we're going to hear from our sponsors again, the people who help us so much, such as AUN and the DBTV Network, Fairway, Symbios. We're going to give you Symbios information. We're going to give you Dr. Reno's information again. So stick around and come back. We're going to finally finish this up saying these are things that you can do. And these are things we need to be asking our doctors, do you do this? Because if we ask enough, somebody's going to say, gee, it's about time. And you know what? We need stories like what I've heard from Symbios and what you heard. So we'll be right back after these words from all of our partners. This is Veterans Impact. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. I want to tell you, this has been a great conversation because it's all about health and healing with Dr. Sherine Reno. Is that correct? I have,
yes.
Okay. It's a little bit unusual spelling for me. And again, I don't have my glasses on, so I'm at a disadvantage. But this has been a fantastic conversation. Again, where can people go to find out about you and be able to, talk to you, get a consultation, get treatment, get referrals? Where do you go?
Right. Well, of course, you can always call 214-342-0400. We have an Instagram account, Performance Sports Med, and a Facebook account, Performance Sports Medicine, Inc. And basically also a website at www.performance-sportsmed.com.
Well, I hope that you'll put this program on your Facebook as well. We'll send it to you.
I would love to.
Yes, and let people know you got that. Now, also Symbios. Symbios is SYMBIOSCCN.com. They're here in Dallas as well. They're down near Love Field and I-35. They are really more into veterans, but that's being changed. And we're working with first responders. We're going to be at a fair this next week for the Garland Police Department. It's important that our first responders, our veterans, and I got to tell you, our senior citizens, these people need help and need healing. And unfortunately, our medical profession, and maybe I'm making an indictment that's incorrect, but they just don't embrace this. Or would you agree with me or not agree? Would you argue with me on that, Dr. Reno?
I think our medical community is absolutely wonderful. We've taken things to a great level, but at some point in time, I would like to see more of us incorporate a more comprehensive approach. I think we'll have a better overall outcome in the end. So I don't want to disrespect anybody. I am from that community, and I
understand.
I know that everything they taught me, I use every single day to work with my patients. I'm just, adding other things back in. And I think that we'll all, I'm kind of excited about RFK, hopefully, because he has a little bit more of that mindset coming in.
We're working to get him on this program. We may be able to do that. And I got to tell you, under the Trump administration before, I had Secretary Wilkie on 3 times. I'm thinking and hoping that we will be able to get whoever the new secretary is and focus on this, because I know the VA talks about it. I know the VA has people involved with it, but I don't think they're to the level that is helping veterans, that we can help veterans. But let me tell you something. What most people don't realize is 70% of the veterans in the United States, or doctors in the United States, medical professionals, have practiced in the VA, have had some experience with the VA. What the VA does can lead the nation. What the VA does can really help everybody, civilian, first responder, military. And that VA is one of the most important medical tools this nation has. It's the largest in the world as a medical provider. And so the more we can do to integrate these things, the more we can do to help people, especially my generation. I mean, I'm a baby boomer, born in 46. I'm getting to be one of those people where I'm not going quite as fast anymore, right? Yeah, but I still can do a whole lot more than other people. And one of the other things is sometimes if you were to use an integrative, when you means integrate, correct? So integrative health is you're integrating this into traditional medicine.
Correct.
So you may be able to alleviate surgery. You may be able to get the body to recover enough where surgery was effective. You may be able to do a follow-up after surgery.
I can see we do a lot of treatment post-surgery and get great results. People who just needed a little extra help. We've actually been sent amputees that we get their stumps to heal well enough that they can actually work in their prosthesis. And, that was kind of like phenomenal to me, people that just hadn't been able to have their skin heal enough to actually wear it and things. and we were able to do that. So it helps after surgery too.
Yeah, and the vector really helps with that. The laser helps with what you're talking about, and the laser helps with burn victims. I found out chemical burns are different from maybe other type of burns, and those are very happy. And what they found out in the Chicago Burn Clinic is that this would help them recover chemical burns, which is amazing. And that's something that's not just the military. Civilian world has that as well. So I am so thankful. Again, we want people to go to, Performance Sports Medicine, correct? Performance Sports
Correct.
Medicine. And you've got a Facebook site. You've got a website. Go ahead and tell me what that
Got
is.
Instagram. Yeah, the website is www.performance-sportsmed.com. Our Facebook is Performance Sports Medicine, Inc. And our Instagram is Performance Sports Med.
You
So
bet.
go to any of those sites and you'll be able to find us. And again, just call 214-342-0400.
And what I found, whether it's with the laser or with the vector, is you need to have that medical attention. You need to have a medical doctor. You mentioned Dr. John Townsend, works for Symbios. Incredible. We need to have this integrative approach. So thank you for being on board, and thank you for all you did, and thank you for coming in at the last minute, because everything kind of went south on me today, but I am so thankful that you were able to join me. So I want to say a quick prayer. Lord God, we thank you for our active duty military and first responders, those that run into the fire instead of away from it. And dear God, thank you for the medical professionals like Dr. Reno and the many others that are integrating whole health and integrating process to bring us back to health. Thank you, dear God, for our veterans who are leading the way in this nation to bring it back together again. Thank you, dear God, and we pray for all of this to come together, one nation, under God, indivisible, with liberty and justice for all. Thank you, dear Lord. Amen. Well, Dr. Reno, this has been, I hope you've had fun.
I have. It's been great.
Yeah.
actually.
And you didn't think, that was 11th hour. I called you and you jumped in. I am very, very, very appreciative. Thank you.
Well, thank you for having me on. I do
You
appreciate
bet.
it too. It was a great conversation.
All right. Veterans Impact Show, we're here for you. Share this. This is great information. Thank you.